Right now, while you're watching this, your prostate might be swelling because of something you ate this morning, something that seemed completely harmless, something you've been eating for decades without questioning it. And the worst part? It's not just one thing. There are three specific foods that millions of men over 50 consume daily, foods that are silently inflaming your prostate, weakening your bladder, and stealing your ability to sleep through the night. I'm Dr. Natalia Parker, and I'm going to explain this clearly. Listen, I've been a urologist for over 15 years, and I've seen the same pattern repeat itself hundreds of times. Men come into my office exhausted, frustrated, sometimes even ashamed, thinking their body is simply giving up on them. They tell me they're waking up 3, 4, 5 times every night. They describe a weak stream, that terrible sensation of never fully emptying their bladder, and in many cases, something even more delicate, difficulty maintaining erections or unexpected leaks. And you know what almost all of them have in common? They have no idea that what they're putting on their plate every single day is directly connected to what's happening in their body at night. Now, I'm not telling you this to scare you. I'm telling you this because knowledge is power, and most men never get this information clearly explained. They think prostate enlargement is just an inevitable part of aging. They resign themselves to medication, to embarrassing symptoms, to sleepless nights. But here's what changed my entire approach to treating prostate issues. When I started analyzing the dietary patterns of my patients, I found something remarkable. Three specific foods kept appearing again and again in the diets of men with the worst symptoms. And when these men made targeted changes, not drastic overhauls, just strategic adjustments, something incredible happened. They started sleeping 7 hours straight. Their urinary stream got stronger. The leaks reduced or disappeared completely. They felt like they had control over their bodies again. And I want you to pay very close attention to what I'm about to say. You don't need expensive medications to start seeing improvement. You don't need surgery to take the first step. What you need is clear, scientific, accessible information, the truth without decoration. So today, I'm going to reveal the three foods that seem innocent but are damaging your prostate every single day without you realizing it. I'll explain exactly how they work inside your body, how they inflame, how they weaken your bladder, and why they might be robbing you of rest, energy, and confidence. Stay with me until the end because I'm also going to give you a simple 30-day nutritional strategy so you can test the difference in your own body. Before I name these three foods and explain the mechanisms behind them, we need to understand something fundamental about prostate physiology and why diet has such a massive influence. Your prostate is a small gland that surrounds your urethra, the tube that carries urine out of your body. As you age, this gland can increase in volume, creating partial obstruction and urinary symptoms. But here's what most doctors don't emphasize enough. This process isn't just about aging. It's heavily influenced by hormones, by chronic inflammation, by your metabolic health, and by your gut microbiome. Prostate inflammation doesn't always hurt. In fact, it's usually silent. It manifests as urinary urgency, weak stream, or leaks. Medical evidence shows a consistent relationship between metabolic syndrome, that's abdominal obesity, insulin resistance, high triglycerides, and elevated blood pressure, and a higher risk of benign prostatic hyperplasia and lower urinary tract symptoms. In practical terms, what this means is that what you eat and how your body processes those foods directly determines the health of your prostate. If you want to attack the problem at its root, you need to understand that diet and metabolism don't just affect your heart or your waistline, they directly affect prostate function. For those who want the scientific reference, multiple reviews and meta-analyses have found associations between metabolic syndrome and BPH, benign prostatic hyperplasia, and lower urinary tract symptoms. That gives us the framework. If we can improve systemic inflammation and insulin resistance, we can reduce the likelihood that your prostate will swell and compress your urethra. Now we get to the central part. The three foods or food groups that many men eat daily and that, through different mechanisms, act as silent enemies of your prostate. Each one operates on a different front. One alters your metabolic biochemistry. Another promotes inflammation and factors related to cancer or enlargement. And the third acts as a direct irritant to your bladder, triggering urgency and leaks. I'm going to break down why, with what evidence, and what to do to replace them practically. Enemy number one: refined sugars and fructose. The first enemy is probably the one you least expected: excess sugars, particularly fructose and high fructose corn syrup, which are abundant in sodas, industrial juices, many smoothies, candies, and processed foods. Fructose has a particular characteristic. Its primary metabolism occurs in the liver and promotes lipogenesis, fat formation, insulin resistance, and a pro-inflammatory state that affects distant organs, including your prostate. Experimental studies in animals have shown inflammatory infiltration of the prostate after high fructose diets. Preclinical models report changes in inflammatory markers when fructose intake is elevated. In humans, the relationship is more complex, but there is epidemiological evidence linking diets high in simple sugars to suspected progression of prostate disease. Additionally, metabolic syndrome, which is strongly mediated by diets high in sugar and ultra-processed foods, is associated with greater risk and severity of benign prostatic hyperplasia. This isn't mere correlation. The inflammatory pattern, markers like C-reactive protein, rise in the presence of chronic fructose consumption and refined carbohydrates, which can favor stromal and epithelial growth of the prostate over time. In summary, if you're drinking sodas every day, consuming lots of commercial juices, pastries, and processed snacks, you're feeding a metabolic process that indirectly pushes your prostate to inflame and generate symptoms. Recent evidence even documents immunological mechanisms where fructose favors inflammatory pathways that, in experimental models, increase organ inflammation. This makes sugar a real and daily enemy of your prostate. But here's what I want you to understand. This isn't about perfection. This is about awareness and gradual change. What do you do in practice? Reduce and eliminate sugary drinks. Avoid industrial juices. Limit sweets and pastries. Substitute with whole fruits with low glycemic index, blueberries, berries, water with lemon, and green tea. If you're worried about fruit, remember that the fiber in whole fruit moderates absorption. The real problem is free sugars and liquids with high caloric density. Starting with this step reduces systemic inflammation and usually translates to less nighttime urination frequency and less urgency sensation within a few weeks. Now, enemy number two: whole dairy products, fatty cheeses, and processed meats. The second enemy is the block formed by high-fat dairy products, whole milk, fatty cheeses, ice cream, and by red and processed meats consumed frequently, deli meats, sausages, smoked meats. The relationship between these foods and the prostate has several edges. On one hand, persistent consumption of saturated fats and certain compounds formed during meat processing and cooking, like polycyclic aromatic hydrocarbons and heterocyclic amines, have been linked to higher risk of prostate cancer in some reviews and meta-analyses. On the other hand, dairy products rich in calcium have been associated in multiple meta-analyses with a modest increase in prostate cancer risk, possibly through influence on IGF-1, insulin-like growth factor, and hormonal mechanisms. While the exact link to benign hyperplasia isn't always direct, the metabolic inflammation promoted by saturated fats and caloric excess contributes to a pro-inflammatory environment in the body. Additionally, abdominal fat and obesity, frequently fueled by these diets, reduce testosterone bioavailability and alter hormonal balance, which can indirectly favor prostate dysfunction. In practical terms, recent studies and reviews suggest that a dietary pattern very high in processed meats and whole dairy is associated with worse prostate outcomes compared to diets rich in plants, fish, and unsaturated fats. This isn't about demonizing an occasional serving of meat or a glass of milk. It's about understanding that daily habitual consumption, with frequency and in excess, can build a landscape of risk for prostate and urinary health. And here's where it gets interesting, because I know what you're thinking. You're thinking, but doctor, I've been eating these foods my whole life, And that's exactly the point. The damage is cumulative, it's silent. It builds over years until one day you're 55, 60, 65, and suddenly you can't sleep through the night anymore. What do you do in practice? Reduce processed meats to a minimum. Prefer lean meats, fish rich in omega 3, salmon, mackerel, legumes, and plant based protein sources. Switch from whole milk to low fat options or unsweetened plant alternatives. Introduce healthy fats like avocado, olive oil, and nuts. This pattern not only reduces prostate inflammation, but improves your overall metabolic profile, favoring abdominal fat loss and hormonal recovery. Comment below where you're watching this from, because I'm seeing men from all over the world dealing with exactly this situation, and I want to know if this information is reaching you. Now, enemy number 3, and this one you're going to feel immediately: caffeine, coffee, energy drinks, and alcohol as direct irritants. The third enemy is more immediate and perhaps the easiest to notice: caffeine and alcohol. Both are consumed by millions every single day. Coffee in the morning, tea, energy drinks, and maybe a drink at night. Caffeine is a stimulant that acts as a mild diuretic and lowers the threshold for bladder sensation. In other words, it makes your bladder feel like it needs to empty more quickly. In patients with lower urinary tract symptoms or overactive bladder, reducing caffeine is a common recommendation in clinical guidelines. Studies demonstrate that caffeine intake increases urinary frequency and urgency, and that its reduction alleviates these symptoms. Urological guidelines suggest modifying fluid intake and reducing caffeine as a non-pharmacological measure to control urgency and frequency. In parallel, alcohol, especially in excess, produces bladder irritation and diuresis, which also worsens nocturia. In clinical practice, many patients notice improvement in continence and fewer nighttime awakenings when they reduce coffee, black tea, and energy drinks. The evidence and clinical guidelines support this approach and consider it a first-line intervention in conservative management of urinary symptoms. What do you do in practice? Limit coffee to 1 or 2 cups per day. Avoid energy drinks and strong tea in the afternoon. Reduce alcohol completely if you notice nighttime urgency. Try replacements like decaffeinated tea, herbal infusions, or infused water. Controlling caffeine usually translates to reduced urgency episodes and fewer leaks within days. Let me tell you about 3 real cases, respecting anonymity, that illustrate the real life behind these mechanisms. The first, a 62-year-old man with nocturia who was drinking 2 cans of sugary soda and natural juice every day. By eliminating those drinks and starting water, his number of nighttime awakenings dropped from 5 to 2 in 3 weeks. The second, a 67-year-old patient with recurrent prostatitis and a diet high in deli meats and cheese, who, after reducing processed foods and increasing fish and vegetables, avoided new infections and improved his urinary flow in 2 months. The third, a 70-year-old man who drank 3 very strong coffees a day and was waking up several times a night. By moderating coffee to 1 cup in the morning and taking decaffeinated tea the rest of the day, he noticed less urgency and leakage. These examples aren't isolated anecdotes. They reproduce patterns documented in literature and in clinical practice. If the body is a diary, diet is the ink, and changing what you write changes the story. So if you want to convert knowledge into results, here's a practical and realistic plan for 30 days. Days 1 through 7, eliminate sugary drinks, reduce coffee to 1 cup, introduce 1 daily serving of low-sugar fruits, blueberries, strawberries, and increase water. Days 8 through 15, eliminate processed meats and limit red meat to 2 servings per week. Introduce fish twice a week and legumes as a substitute. Days 16 through 23, incorporate anti-inflammatory foods like pomegranate or moderate watermelon. Add 1 serving of avocado daily and practice conscious hydration. Don't drink large volumes right before sleeping. Days 24 through 30, add pelvic floor exercises, Kegels. Continue with sugar and caffeine reduction and evaluate changes: number of nighttime awakenings, stream strength, urgency sensation, and leaks. Keep avoiding diary and symptom log. If you don't improve or if you worsen, see your urologist for complete evaluation. This plan is feasible and is backed by the principle of reducing inflammation, improving circulation, and eliminating direct irritants. Now, it's crucial to understand that these changes are preventive and conservative. They don't replace diagnosis or medical treatment. If you have blood in your urine, intense pain, fever, inability to urinate, or sudden loss of control, you must go to the emergency room or to your urologist immediately. If you have a history of prostate cancer, oncological treatments, or suspected elevated PSA, talk to your specialist before making drastic changes because some adjustments require medical supervision. For most men with mild to moderate symptoms, these dietary and lifestyle measures are safe and effective as part of comprehensive management. Men, listening to this is already an act of courage. The real enemy of your prostate often isn't invisible or mysterious. It's what you put in your mouth every day without thinking too much about it. But the good news is that you have power. By reducing added sugars and industrial juices, moderating whole dairy and processed foods, decreasing processed meats, limiting caffeine and alcohol, these are small decisions with big impact over weeks and months. If you apply the 30-day plan I gave you, you'll start noticing fewer nighttime awakenings, more strength in your stream, and fewer leaks. This isn't a trick. It's changing your body chemistry to reduce inflammation and improve function. If you found this video helpful, hit that like button and subscribe for more reliable medical content. Leave in the comments which of these 3 enemies you consumed today and which one you're going to reduce. Share your experience in 30 days, and I'll be reading and responding. If you want, in the next video, I can give you practical recipes, a week's worth of menus, and a visual guide for your shopping list. Remember, your prostate doesn't define your masculinity, but your care does define your future.